If you're taking certain medications, you could be damaging your kidneys without realizing it. Some of the most common drugs, ones you might take every day, could be silently putting your kidney function at risk. Today, we're exposing 7 medications that harm your kidneys and what you can do instead. Subscribe now for more health-saving tips, and let's get started. Number 7. NSAIDs. Painkillers like ibuprofen, naproxen, and aspirin are great for temporary relief, but if you take them too often, they can seriously harm your kidneys over time. These drugs work by blocking pain and inflammation, but they also reduce blood flow to your kidneys, which can impact their ability to filter toxins. If you have chronic kidney disease or diabetes, this is even more dangerous because your kidneys are already under strain. Doctors see this all the time. Patients who take NSAIDs daily for years, not realizing they're slowly damaging their kidneys. If you rely on NSAIDs regularly, here's what you can do instead. Switch to acetaminophen or Tylenol if pain relief is needed. Unlike NSAIDs, it doesn't reduce blood flow to the kidneys. Try natural anti-inflammatories like turmeric or omega-3 supplements to reduce pain without harming kidney function. Always take the lowest effective dose and avoid daily use unless absolutely necessary. Number 6. Antibiotics. Antibiotics save lives, but they can also put a massive strain on your kidneys. Many people take antibiotics when they don't actually need them, assuming they'll help with a cold or flu. But antibiotics don't work against viruses. Some antibiotics, especially aminoglycosides and vancomycin, are directly toxic to kidney cells when taken in high doses or for extended periods. Long-term antibiotic use can also wipe out good gut bacteria, leading to something called leaky gut, which makes it even harder for your kidneys to filter waste properly. If you need antibiotics, here's how to minimize the damage. Only take them when absolutely necessary. Don't pressure your doctor for antibiotics if you have a viral infection. Stay hydrated while taking antibiotics to help your kidneys flush out the medication properly. Consider probiotics to rebuild good gut bacteria and reduce stress on your kidneys. And if you have existing kidney disease, make sure your doctor is adjusting the dose to avoid unnecessary strain on your kidneys. Number 5. Diuretics or water pills. Diuretics are often prescribed for high blood pressure, swelling, and heart conditions because they help your body get rid of extra fluid. But here's the problem. Too much diuretic use can lead to dehydration and electrolyte imbalances, which forces your kidneys to work harder than they should. Over time, this can lead to kidney dysfunction, low potassium levels, and severe dehydration. One big mistake people make is combining diuretics with other drugs that have diuretic effects, like Jardiance, a diabetes medication that also acts as a diuretic. If you're taking diuretics, here's how to protect your kidneys. Monitor your hydration. If your urine is dark, you're dehydrated. If it's completely clear, you might be overhydrated. A pale yellow color is ideal. Talk to your doctor about adjusting your dose if you feel excessively thirsty, weak, or dizzy. Balance electrolytes by eating potassium-rich foods like spinach, avocados, and bananas, unless you have kidney disease, in which case your potassium intake should be carefully managed. Diuretics are helpful in many cases, but they should be used wisely and with caution to avoid unnecessary kidney damage. Number 4. Proton pump inhibitors for acid reflux. Millions of people take proton pump inhibitors like Nexium, Prilosec, and Protonix to control acid reflux and heartburn. While they provide relief, long-term use of PPIs can increase the risk of kidney disease. PPIs reduce stomach acid, which may seem like a good thing, but stomach acid is essential for digesting proteins and absorbing nutrients. Without enough stomach acid, food passes through undigested, allowing bad bacteria to grow in the gut. Over time, this disrupts gut health and can lead to kidney inflammation. Some studies show that people who take PPIs for years are at a higher risk for chronic kidney disease and interstitial nephritis, a condition where the kidneys become inflamed and swollen. If you need acid reflux relief, here's what you can do instead. Try H2 blockers like Pepcid or Zantac, which are generally safer for kidney health. Use natural remedies like ginger tea, aloe vera juice, or apple cider vinegar to balance stomach acid naturally. Limit trigger foods like spicy meals, fried foods, and excessive caffeine to prevent reflux in the first place. PPIs can be useful for short-term relief, but long-term dependence can lead to serious kidney complications. Number 3. Imaging contrast dyes. Medical imaging like CT scans, MRIs, and angiograms often require contrast dyes, which can be toxic to your kidneys. This is especially dangerous for people with diabetes or kidney disease, since their kidneys already have trouble filtering waste. Contrast-induced nephropathy is a real condition where the kidneys become damaged after exposure to these dyes. If you need imaging that requires contrast dye, here's what to do. Drink plenty of water before and after the scan to help your kidneys flush out the dye. Ask your doctor if the scan is absolutely necessary, or if an alternative like ultrasound can be used instead. If you're taking metformin, ask your doctor about stopping it before the scan, as it can interact with contrast dye and worsen kidney damage. Being proactive can greatly reduce your risk of kidney complications from medical imaging procedures. Number 2. Laxatives and overuse of fiber supplements. Laxatives seem harmless, but using them too frequently can seriously impact kidney function. Overuse of laxatives can cause dehydration and electrolyte imbalances, making your kidneys work overtime to restore balance. Some laxatives, especially those containing sodium phosphate, can actually form kidney-damaging crystals over time, which can lead to kidney stones or blockages in the urinary tract. If you struggle with constipation, here's what to do instead. Increase fiber intake naturally through whole foods like chia seeds, flax seeds, and leafy greens. Stay hydrated. Constipation often happens due to lack of water, not lack of fiber. Use magnesium citrate supplements if needed, as they can help with bowel movements without harming kidney function. Laxatives should be a last resort, not a regular habit. Number 1. Metformin and diabetes medications. Metformin is one of the most prescribed medications for type 2 diabetes and is widely considered safe and effective for lowering blood sugar. But what most people don't realize is that metformin is processed through the kidneys, and if your kidney function declines, this drug can become dangerous, even life-threatening. In people with reduced kidney function, metformin can build up in the bloodstream instead of being properly excreted. This increases the risk of lactic acidosis, a rare but serious condition where lactic acid accumulates in the body, leading to fatigue, muscle pain, confusion, difficulty breathing, and even organ failure. The risk is especially high if you have kidney disease or reduced kidney function. Even mild impairment can increase risk. Take other kidney-affecting medications like NSAIDs or diuretics. Are over 65, as kidney function naturally declines with age. Are dehydrated or fasting, which can slow the elimination of metformin from your system. Most people on metformin never experience issues, but doctors routinely monitor kidney function in patients taking this drug because the risks increase over time. So what can you do? Get regular kidney function tests to ensure your body is clearing metformin properly. If your kidney function drops below a certain level, your doctor may need to adjust your dose or switch medications. Stay hydrated and avoid excessive alcohol consumption, as dehydration makes it harder for the kidneys to clear metformin from your system. Consider natural blood sugar management strategies like berberine or dihydroberberine, which studies suggest may be just as effective as metformin in regulating blood sugar without kidney risks. Talk to your doctor about alternatives like SGLT2 inhibitors or GLP-1 receptor agonists, which have different mechanisms of action and may be safer for people with declining kidney function. Metformin is a powerful tool for managing diabetes, but if your kidneys aren't functioning properly, it could do more harm than good. Many people assume all diabetes medications are safe, but failing to monitor kidney health can lead to unexpected complications. If you're taking metformin or other diabetes medications, be proactive. Get your kidney function checked regularly. Explore safer alternatives if needed, and take care of your kidneys. Because once kidney damage starts, it's often irreversible. If you found this video helpful, subscribe for more science-backed health tips, and check out our next video on hidden causes of kidney failure you need to know.